latest data, our team of experts now agrees that we can begin the next front in our war, which we are calling opening up America again. And that's what we're doing. We're opening up our country. And we have to do that. America wants to be open, and Americans want to be open. As I have said for some time now, a national shutdown is not a sustainable long-term solution. To preserve the health of our citizens, we must also preserve the health and functioning of our economy. Over the long haul, you can't do one without the other, cannot be done. To keep vital supply chains running, these chains have to be taken care of so delicately. They're delicate. The balance is delicate. We want to deliver food and medical supply. We must have a working economy, and we want to get it back very, very quickly. And that's what's going to happen. I believe it will boom.
It is our expectation that we will have tested more than 5 million Americans before the end of the month of April, and we'll continue to scale those resources. So testing and medical supplies will continue to be an ongoing partnership with our states, and we want our healthcare workers and people all across the country to know of our commitment to that. Finally, the President directed us to propose a phased approach to reopening our economy. It is based on up-to-date data and readiness. We'll continue to provide the very best data to our states, working with their health officials. The focus is on the mitigation of any risk of resurgence or the emergence of the coronavirus in states where it's not yet emerged. There is a focus in the President's new guidelines on the most vulnerable. And we made this very clear to the governors today. These new guidelines for opening up America again can be implemented on a statewide basis or on a county-by-county basis. With that, I'm happy to turn it over to Dr. Deborah Birx. And if I may, Mr. President, I'd like to also extend my admiration and appreciation to Dr. Birx, Dr. Fauci, and every member of our task force that worked around the clock to develop these recommendations for opening up America, where I know every American is grateful for your leadership and for theirs.
First of all, in order to even consider getting into the phasing, you have to pass a hurdle. And that's the hurdle that we refer to as gating in. Now, when you think about it and look at the map of the country and look at the differences in different parts of the country, you will see that there are some regions, states, locations that are going to be almost already into some of that gating and will have already fulfilled some of those criteria. Others, because of the dynamics of the outbreak in the area, will take longer to be able to do that. But you don't get to phase one until you get through the gating. And then in order to make sure that safety and health is the dominant issue, the design of the phases were just that. You go into phase one, if you get no rebound, and you satisfy the gating for yet again a second time, then you go to phase two. If you have no rebound and you satisfy the gating criteria for a third time, you go into phase three. So there are multiple checkpoints of safety there. So as I've said from this podium, when we were talking about the first 15 days of the mitigation, and then we extended it another 30 days, I essentially pleaded with the American public to say, let us make sure we do the best that we can to accomplish that. And in fact, mitigation works. You saw the charts that the Vice President and that Dr. Birx put up. It worked. And what we hope, and I believe we will be successful, if we carefully do this, again, with the attention to the safety and health of the American public, that we will be able to, it will be staggered. Not every state, not every region is going to do it at the same time. That's clearly obvious because of the varied dynamics of the outbreak. But we feel confident that sooner or later, we will get to the point, hopefully sooner, with safety as the most important thing, to a point where we can get back to some form of normality. The one thing I liked about it that Dr. Birx said so well is that no matter what phase you're in, there are certain fundamental things that we've done that are not like it was in September and October. You want to call it the new normal, you can call it whatever you want. But even if you are in phase 1, 2, 3, it's not okay, game over. It's not. It's going to be a way that we protect ourselves because, as we know, and as I've said from this podium, it may very well be, as we go the cycle around, that there'll be this virus that wants to come back to us. I think we're going to be able to handle that. Thank you.
You'll recognize this slide. It's what we've been talking about in the 15 and 30 days to prevent the spread. It's continuing those critical hand washing or sanitizers, not avoiding touching your face at all times, disinfecting surfaces, using face covering while in public, following state and local guidelines, and critically, staying home if you are sick. I know a lot of people go to the workplace when they are feeling ill. You know when you're feeling ill. It won't get better by going to work. So we're asking again for people to stay home when they're sick. Next slide is for employers to ensure that there can be social distancing and protective equipment, temperature checks, use of disinfectant in high traffic areas, including break rooms, and ensuring that we don't do there's no non-essential business travel, and then monitoring for any symptomatic individuals in the workplace. And again, if you become ill at work, to immediately to go home. And ensure that there's contact tracing of all the individuals that become sick. I'm going to go through the phases very quickly, but you have the details. Phase 1. Again, you have to go through those gating criteria related to 14 days of decreasing evidence of illness and decreasing testing despite adequate testing. So phase 1 begins with all vulnerable individuals, including those with comorbidities, continuing to shelter in place, and ensuring that those that first go out into the public are not those that are most vulnerable to bad outcomes in this disease. And then ensuring that we continue to do 6 feet maximum physical distancing in public spaces, continuing to avoid large gatherings, and all non-essential travel. For the employers, next slide. Again, if a vulnerable population needs to return to work and cannot be teleworking, there should be special accommodations for all vulnerable populations, as well as options for teleworking. We believe every employee should encourage work return in phases from 20% or 25% to 40% to 50%. And again, minimize all non-essential travel. Phase 1 continued. Next slide. If the schools are already closed, they should remain closed. All visits to senior living facilities and hospitals should continue to be prohibited. Large venues, including sit-down dining, can only be operated under strict physical distancing protocols and maintaining those 6 feet. Gyms could open if they, again, could adhere to strict physical distancing, and elective surgeries can resume on an outpatient basis. Phase 2. Next slide. Next slide. Again, you have to go through the criteria again of a continuation of another 14-day decline among those criteria that were in the gating. Again, we're asking for all vulnerable individuals shelter in place. We did not put a timeline on any of the phases. We want the governors, with the data that they have, community by community, to be setting up those timelines. Again, we're asking for the public to continue to maximize physical distance. However, we increased social settings to be able to now have 50 individuals, and non-essential travel can resume. Next slide. This is for the employers. We still would like to encourage telework, and the common areas should remain closed or be physically distanced. All non-essential travel for employees can resume. And then again, special accommodations for vulnerable. Next slide. This should be a relief to many of households that have small children. Schools, daycares, and camps can reopen in phase 2. Visits to senior living facilities, however, should remain in hospitals prohibited. Large venues can operate, but solely under moderate physical distancing, and elective surgeries can resume on an outpatient and inpatient basis. Phase 3. And so phase 3, I won't go through in detail, is essentially returning to our new normal with all of what we talked about through all phases, continuing the good hygiene practices, continuing the respect for spaces between individuals, because we know that we still have an issue with asymptomatic spread. I do believe with this plan that we're both confronting the issue of finding symptomatic individuals through our networks with early alert, as well as those who come and present to different hospitals and emergency room with testing and contact tracing, but critically have put in place what we believe is a safety net through asymptomatic sentinel surveillance that is centered around our most vulnerable groups between nursing homes and our Native American people and indigenous populations, and our inner city groups that we know may be in multi-generational households and of unique risk.
Truthfully, for those states that aren't ready to go to phase one, to get through these phases, do we have an idea of how many millions, tens of millions of tests they're going to need for them to get through these phases? Any number out there? A test of any sort?
Yeah, so I mean, you've heard me talk about tests for a while from the podium, and I think what has happened over the last several weeks is hospitals and clinics that could move to the more point-of-care test, move to those point-of-care tests. And what it's left is an amazing array of capacity that exists in the country for at least 1 million more tests per week. So we have a whole team working lab by lab to see what it would take to turn on all of those labs that aren't running the pieces of equipment now. So you see in the system, I just said to you, there's 1 million more tests per week, that we have tests sitting there and equipment sitting there, and now we have to really deal with each single lab to really figure out what they need. And I just want to thank Administrator Verma, Seema Verma, who went through with us, and thanks to the lab directors, they really explained to us highly technical difficulty to run some of these big pieces of equipment, because you have to aliquot the samples, you have to centrifuge, you have to put them on the machine. It takes a tech full time. At $50 a test, it wasn't enough to hire another technician to run the machine full time. So at $100 a test, it is. So those are the kinds of changes we have to make bit by bit by bit. But that alone doubles our testing capacity per week. So we're committed to work with laboratories to answer every one of their issues with the state and local governments. And I think, frankly, every conversation I have, and the governors will say, I need 5,000 people tested. And I say, well, at the University of X, there are 6,700 tests waiting for you. So it's more of making sure that every governor and every public health official knows exactly where every lab is and where the tests are, so we can create with them a real understanding so all these tests can be run. So yes, there is twice the capacity right now.